Hello, everyone. Good morning. A very good morning to all the viewers, all the students who are watching this quiz. I'm Dr. Rohini, and you are watching Unacademy. And we have a lot of curriculum in the Unacademy. This is one of them. We are going to do a lot of picture-based classes. We do a lot of quizzes and MCQs, etc. And in my curriculum today, I have quiz. Okay, so this is going to be the last session in the osteology quiz. So here, this is something that has been going on for 3-4 days. So this is quiz part 3. So I'm going to end with this particular quiz. So you would have gathered a lot of osteology questions by now. Okay, so make sure you retain all of them and you make a playlist, watch it again and again. So that way you will be able to retain in your head. So by repeating, you can remember the things really well. That is my tip. Okay, so try to repeat, recall, repeat, recall. So that will give you a nice foundation in your head with the subject. Okay, I'm Dr. Rohini, and this is my credentials. I'm MD from KMC Bangalore, that is located in Karnataka. This is in the coastal region, and all the colleges in the coastal region are really fine, to be frank with. So this is a deemed university, and I'm somehow associated with a lot of deemed universities. So this is deemed university, and PhD is from Savita University, that is also deemed university, and this is located in Tamil Nadu, Chennai. Okay, so I also have one more to you know uh, display. That is, I studied abroad. My medical transcription and MBA is from abroad, USA. That is from Georgia. Okay, so my work profile is from USA. I have about 9 years of experience working for the hospital RMH. This is located in Harrisonburg, USA. With all these, I would like to call myself a good guide also. So if you think you should seek guidance from me, you can also join my group, that is Anatomy by Dr. Rohini. So you join this Telegram group. We discuss a lot of MCQs. We also discuss picture-based questions and many things. At least every day you will have 2-3 questions from the picture-based section. And also a lot of MCQs. You can send in your answers in the group itself. And then later on we discuss. And regarding the subscription also, we talk about if there is anyone who is interested in the subscription. So you will have sometimes, difficulty in entering the code, or you don't know what are the steps to subscribe, and you may not have come across that section at all. So I will guide you with a subscription and make sure that you get a good subscription at a good 10% discount. Okay, so you can join my Telegram group, Anatomy by Dr. Rohini. Okay, so that is one. And in case you are already into the subscription, you don't know the code, this is my code. This is called the unlock code, ROHINI 10. Okay, so by using this unlock code, you will be able to get discount of 10%. And not just that, if you want to go access any free classes, it will always ask you for unlock code. So when you go for subscription, of course, the person will give you a code. So instead of that, if you use this code, it will be beneficial for us also. Okay, so use this code Rohini 10 when you go for subscription, and anywhere the code is asked, this is the thing that you can use. All right, so with this, I would like to continue. Okay, just let me make sure that nobody has any queries, questions regarding, no, I hope I'm able to. Right, so let me just share this. All right. So here it is. Subtopic. We are going to have a quiz. This is in the osteology. Let's see how many of you will be able to get the answers right. Okay. So this is plus subscription. Let me just give information on what you can do with the Unacademy. Then later on we'll move with the quiz. Okay. So here is plus subscription. So with the plus subscription, what can you do? You can access both the live and the recorded session. So all this, both live and the recorded sessions, are really going to be useful for you, because in case you miss the live session, you always have the recorded session in hand, and then you can watch it anytime, anywhere. Okay, so this is one nice feature about the plus subscription. And also all the top educators, they're all handpicked, and you can get experience, learning experience from all these favorite educators. And you will also be rewarded with hats, and that those hats you can dedicate to the educators, and in turn you will also be benefited. So that is something. And then there is always in live test and quiz you can compete. There are so many tests conducted, so many quizzes conducted, and you will always be kept on your toes, and you will start looking forward to the test, because so you will get so used to all that kind of curriculum that you'll start looking for it. And you can study on any device. You need not wait for one particular device. So you can even watch it on your mobile phones, Android, or the iPhones you can use. And also you can access about 25,000 question bank questions. So all that is clinical questions, and very effective explanations are there in this. So that is one nice feature of plus subscription. So when you subscribe, you get all this. But when you are just watching these videos, you'll just get whatever we tell. You don't get a proper curriculum. Remember, this is just few percent of what you can get from an academy subscription. So always it is important that you decide early and then you go for subscription, so that you don't have to start searching for the topics here and there. You will be having everything under one single platform, a learning platform, and you will be able to access all the classes. You can also make it like a playlist and play it, and chapter wise you can keep it. So all that is really interesting. You should try with minimum number of months first and see how it goes, and you will get hooked onto it and you'll start liking it, believe me. And when you go for 12 month subscription, you'll also get printed notes. So printed notes, some people are very interested in printed notes, because they cannot study without the printed notes. Okay, because they want to underline and they want to use the printed notes only. So for them, there is also that option. So you can go with the printed notes. And then you can also see there is iconic subscription. So there is Unacademy plus PrepLadder, both you can access in case of iconic. So this is even more better, right? There are more number of educators. There are more things to follow, and many recorded classes, QBanks, and many things. Active guidance is there from all the educators, and rapid revisions are a must when you are about to face the exam. Rapid revisions, you can't keep searching for the MCQ questions. At least 100 MCQs you have to do per day. Where will you keep searching for the MCQs, right? So everything is available handy, and all that you need to do is just start using them. And you can also see there is special classes. I have my special class on Wednesdays. So Wednesday is my special class, and all these classes are very interactive. Like you can see the classes, the YouTube classes itself is so interactive. And then you can imagine those, Wednesday special classes, that you will be able to see me in the on the screen, and you will also be able to interact better. And polls we use for the learners, and you'll know exactly who was the first one to answer the question and who was the next. All that is interesting and motivating. And also you'll never miss a class, because you get notified. Okay, so any class, any educators you have already subscribed, you will get a notification for the classes. So you will never miss a class. You will be definitely looking forward for the class for the entire week. Whatever classes are there, that will be notified to you. And also you will get lecture notes in the form of PDF. So these PDFs are really interesting, because it doesn't get stored in your phone, and it will be there in the app. So you don't have to download, store it somewhere, and then forget where you stored. So all that doesn't happen. It's there in the app itself. And other than that, you also have access to it anytime, anywhere. So when you want to access it, you can just, access it anytime. So it doesn't have to be a particular lock time, or there is any office hours where you have to go at that time only. Nothing like that. So now here you can also see about 25,000 high yield clinical questions you can get with the QBank. And everything is updated according to the latest exam pattern only. And also detailed explanations are given. So if you are a person who is very focused, then you should be looking at all my, classes, including the classes that were conducted yesterday. So I have my classes for INICT also. It doesn't matter what it is. See, preclinical questions are going to be the same. It is not going to be very different from INIC to FMG to NEET. So if you are a student who is aspiring to take up NEET, you can also look at the INICT pattern and see what sort of questions are there. It's always important to learn and get the knowledge. It doesn't matter how the questions are framed, and if you are able to answer the questions from a different framed question, then it is always good. That means you are even more efficient. So try to attend all the classes. It doesn't matter whether it is INICT class or FMG. Try to attend and gain maximum. Okay. And also go for the subscription. Of course, you are getting the discount. So absolutely, you will not feel that any money is wasted, because it is always better to give it your best at one shot than giving multiple tries. So that is definitely going to drain you out. It will not only put your energy down, and also your interest down and enthusiasm down, and also you will not be in a very nice mood set to take up the exam again and again. So it's always good if you are clearing it in your first attempt. And your first attempt, your preparation has to be good. So that's why I'm telling you, go for the subscription and take a good subscription, whatever fits into your budget, whatever fits into your time frame. And then you see how well you can start preparing and how well you can stay focused until your exam. All right. So that is one important thing I wanted to discuss with you all. There is always limited time offer for everything. So now here, this iconic subscription, which has both Unacademy and PrepLadder, also has a limited time. So here what you must do is you should just see what is the final price. This may not remain like this. It may just shoot up and go back to that original 45,000. Okay. So it's sooner the better. 38,250, you are going to save a lot of money, and you'll also get that discount, the 10% discount, when you use my code ROHINI. So please use this code. Okay, ROHINI 10. Okay, use this code. So when you use the code, you are going to be definitely benefited. And the amount of material that you'll get from Unacademy app, and the amount of classes that you are going to number of classes that you are going to attend, all that, if you just count, it is just unlimited. Okay, it is just unlimited, and it has got nothing to, you cannot just compare with the price that you are paying. You're paying just 38,250, and you will get loads and loads of things. And if you just go to buy a book, the books are itself so costly, and we do refer all these books and we make questions for you. All right, so here are some of the very proud star learners. We have FMG students rankings here. Most of them, as you can see, they have got about 180. And see, it is between 180 and very close to 300. So here I have a small session where I have addressed all those FMG students, and I have told them what is your strategy or trick to get maximum out of your 2 months or 2.5 months preparation, because you are just left with 2.5 months and your exam is going to be on December 12th. And what best can you do in this time? Because it is always better to give it a shot than never try and give up. So you should just, if you're still thinking what to do, and if it is not the last day to send in your applications, do so, and follow my strategy, and I have told about picking the topics versus going with the subjects. You have to pick up some 300 to 600 topics depending on your you know strength and stamina to sit down and study for 12 to 16 hours per day. So if you are able to do that and you are able to solve at least 100 MCQs per day, then definitely you are going to be in a better frame to face the exam in 2.5 months. Okay. So if you are of that sort of a person, then you should definitely try and watch that video first, FMG. So I have addressed the FMG students. It is 3 months preparation for FMG students on YouTube. So watch that. It was, I think, little 2 to 3 days back. I had aired it. So just see that, and then you decide if you have still not decided to take up this exam in December. Okay, 2021. All right. So for all those NEET 2022 goers, you still have time. We are with osteology. We will cover up most of the things. And for the 100% complete curriculum coverage, you please do subscription. And this is Target Next 2022 and FMG 2021. All these are parallelly running, courses, about 3 months course and about few months course. And then you also have clinical examinations procedures batch also started on 15th of September. So that also happens. So many things are going on in a parallel track. So here there is boost your medical PG preparation with the 24-month subscription. So you also have freebies to give away here. So that is 4 months subscription you will get for free. Okay, so you take 24 months, you get 4 months free. And you take 12 months, you get 2 months free. So free is there at every step. So for all that freebies you want to gather, please use my code. My code, unlock code, is very, very important. And if you have anyone from any other stream who wants to join Unacademy, not just for NEET, not just for FMG medical related, anything else, you please pass on this code and ask them to join. They will also be benefited with the code. So this is Iconic and Plus subscription EMI option. So here EMI options are just 1406 and 1125 in case of Plus subscription. Here in case of Iconic, this is just per month. So here you will get 48 months subscription, and you also have 36 months, 12 months, and many options you have. But minimum 6 months subscription is what we look at for EMI to get selected for this EMI. All right, so let's see. Let's see what we can start with today. So let's go ahead and start with the questions. I have the question ready for you. And we are going to start with our question number 64. Okay, we are going to start with 64 because there are few questions that my students, you people have not attended, and many have requested to start from there. We are going to start from there. Is there anyone who has any 78? We'll go to that quickly, Murli. Okay. So 64, osteocytes, you answer these questions. Let's see whether you'll be able to get it. Okay. Yes. So 64, osteocytes within the compact bone tissue are located in minute capsules or spaces. What is the name of the capsule or spaces? You tell me now. What is the name of the capsule or spaces? What is it? Okay, that is D, you think? All right, hold on 1 second. Okay, so that is D. You are thinking it is D. Osteocytes within the compact bone tissue are located in minute capsules. So spaces. Are you answering my question number 64? Are you answering 64? What is the answer for 64? Lacunae. Yeah. You said almost all the things. There is A, B, C, D, everything was told. It is lacunae. Yes. It is A. Okay. So that is the gap. It looks something like a, I. Looks like I. And you will have extensions from there. Canaliculi. Okay. Next one. 65. In compact bone, the matrix is laid down in concentric rings like this. Okay, what is this? What is this called? The matrix is laid down in concentric rings. What are these rings called? Are they called osteons, lamellae, canaliculi? It is not canaliculi. It is not trabeculae. Is it lamellae or osteons? This entire thing is called osteon. And each ring is called lamellae. So the answer is B. 65 has the answer B. See, you are able to recall. That means what? It has stayed in your head. You are able to answer. Even if you have answered this before, sometime back, maybe you are able to answer. That means you are able to recall. 66. What builds up the bone while what breaks the bone? Osteoblast, osteoclast. Your answer is B. So 66B, osteoblast. Osteoblast and osteoclast. Okay, so next one. Actually, osteocytes are the older osteoblast. Osteoclast will not give rise to osteocytes. Osteoblast will finally become osteocytes, or even they become the bone lining cells. Okay, so now here we have the 67th one. 67, the calcification is the process of, what is it? Calcification is a process of 67. You think it is A, ossification. It is not osteoporosis. Porosis is breaking down or loss of bone. It is not growth. It is not mitosis is in the cell. It's not growth. This is in the plate, epiphyseal plate. And it is ossification. So the answer is A. Okay, next one, 68. Let's go to the 68th one. What is the process by which minerals are deposited? So minerals are deposited in the matrix of cartilaginous bone tissue. You know that there are three steps. One is the mesenchymal tissue, then it becomes the bone cartilaginous model, then comes the bone. Okay, these are the three steps we have. So here, from cartilages to bone tissue, okay, minerals are deposited in the matrix. So now here, what is the process called? It is called calcification. So it is called C, calcification. All right. Next one, spongy bone, 69. Spongy bone is also called cancellous bone. Cancellous bone, it develops at what centers? So spongy bone is confined to the tips, and it is also present in the medullary cavity. So what do you think? Is it the secondary center or the primary center? It is confined to the primary ossification because that is in the shaft where the ossification starts. Okay, so the answer here is C. All right, so next one, 70. 70. Are you answering 70? What is this? Consists of 5 histological zones. Which one consists of 5 histological zones? Is it epiphyseal plate, ossification center, secondary ossification center, or cartilage rings? Okay, what is the answer for this? What is the answer for this? The answer for 70 is What is the answer for this, Murli? 70 is A, epiphyseal plate. All right. 71, we have 71. The region, what is the region of transformation from cartilage to bone tissue, where it gets transformed from cartilage to bone tissue? Is it ossification zone, calcification zone, or cartilage ring? It cannot be cartilage ring, okay? It is not calcification because it is just deposition of the minerals. That is also no. So the answer here is which one? Cartilage tissue to bone tissue. Ossification zone, calcification zone, or cartilage ring. Ossification is a process where cartilaginous model is turned into bone. So it has to be 71A. All right, it has to be 71A. Okay. The next one. 72. 72. Which of the following is not true? Sorry, which of the following is not one of the four curvatures of the vertebral column? So I drew that curvature yesterday. I showed you there is this cervical, then comes the thoracic, then comes the, lumbar, and then you have this. So you have C, then you have T, then you have L, and you have yes. Okay, so here is the person. So curvatures, cervical is there, lumbar is there, thoracic is there, brachial is a, that name itself indicates that it is arm. So there is no such curvature, brachial curvature. Okay, we also have another person. I don't know how to read that language. I think it is some Japanese or something. Japanese, that is. Okay, so your answer is A. You're right. A. Okay, 70. Wait, Murli, let me read the question. Okay, so processes that limit the twisting of vertebral column are. What are the processes that limit the twisting of Chinese? Yeah, it looks like Chinese. I can't differentiate between Chinese, Japanese. Everything looks same. Processes that limit the twisting of vertebral column are. What limits? That has to be on the sides that will limit the twisting of vertebra. It cannot be in the center. So the ones which are in the center will remove it off. So the spinous process will remove it off because that is in the center. Then lateral process, articular process. Articular process is also on the sides. It's something that is on. Transverse process, lateral process, articular process. So which one do you think? 73 is B. Okay, it's B. Next one, 74th one. Which of the following is not considered to be part of the rib cage? So we have rib cage made up of, rib cage is actually axial skeleton or appendicular. It is considered to be axial skeleton. Okay, it has sternum. We have costal cartilages attached to it. Then we have ribs. What is not considered to be the rib cage is the clavicle. So here we have the answer 74A because we have to find the one which is not belonging to this group. Next one, 75. Let's look at the 75th one. There are three components of the sternum. Okay, there is a first portion that is Give me a second. Okay, this is the sternum and this is the clavicle, and here we have the first rib. It goes like this, and then we have the second rib. Okay, then comes the other ribs. Now you tell me, and then you also have the, okay. So now you tell me which one is where. Which one is where now? Which joint is where? Okay, so now I want you to just find out where is the primary cartilaginous joint, and secondary cartilaginous joint, secondary cartilaginous joint. Okay, now who can tell me which one is primary cartilaginous joint? What about this one? Is it, this is the called the ziphisternal joint. Okay, ziphisternal. What about this one? Is it a primary or a secondary? It is right in the center, so this is secondary cartilaginous joint. Okay, so what about the joint between the first costochondral? This is the first costochondral joint. First costochondral. This is the primary cartilaginous joint. Okay, that is very again important. Primary cartilaginous joint. So now here we have 3 to 7. 3 to 7 are atypical. Synovial joints because they have only one single facets. Remember, they all have single facets, so they are called atypical joints. And the manubriosternal, this is secondary. So basically what you have to do is all the ones which are in the midline are considered to be secondary cartilaginous joint. And the ones which are on the sides are considered to be primary. So keep that in mind. Now this is right in the center. This is the secondary. This is right in the center. That is secondary. And this one is primary. So usually it is asked primary and secondary cartilaginous joint. Okay. So here for the 75th one, we have the answer as B. Did we all get it? We all got the answer as B. Okay, next one, 76th one. Certain structures are common to all the ribs, for example, tubercle, head, neck, and all this. So now you tell me what is the answer for this. What is your answer? What is your answer? Head, neck, head, neck, both B and C. So that is the option. So what do you think your answer is? '76 one, D. 76B. Okay, answer is B, the head portion. Okay, it is common to all because some of them do not have the tubercle, some of them don't have the neck. Tubercle, neck. Okay, these are, I told you, between 3 and 7, they are, atypical synovial joints. So those may not have. So the answer here is D. Okay, answer is B. Next one, 77. Osteoporosis, the disorder characterized by weakening of the bones. We know this primarily as a result of calcium loss is most commonly which group of people? So they're asking whether it is in case of children, whether it is in case of ladies, girls, or men, adults, whom. Let's go to the options. It is postmenopausal, elderly, children, adults, whom. It is, okay, so is your D for this, A, B, C, D, postmenopausal. So it answer is A. So 77 will have the answer as A. Okay. Next one, 78. Let's go to the 78th question. Okay, we also have Manoj answering it really well. The most virulent type of bone cancer, which frequently it will metastasize through the blood to the lungs. Which one? So this one you tell me. The most virulent type of bone cancer, which frequently will. Okay, we have Dr. Logical saying C, and we also have Murli saying C. Osteoid, osteoma, bone cancer is not virulent, they say. What do you think is the answer? Osteogenic sarcoma. Osteogenic sarcomas are the most, the type of cancers which can easily metastasize. But this word is not right actually. Yes, it is C. The next one, 79. The fissure is defined as, what is the fissure actually? Is it a, it is not a fossa, it is not a fovea, it's not a foramen. All those, no. So what is the fissure actually? It's a deep pit or a socket? No, it's not a socket. It's not round also. It is like a slit, right? It is not round. It's a groove that accompanies a vessel nerve. There is nothing like that. It is not a groove. If it was the groove, we would call it as sulcus. Okay, rounded opening through a bone, we would call it as a fossa. A deep pit or a socket, would call it as fovea. Narrow slit like, this word is important. So the answer here is D. 79D. Next one, 80th one. Which of the following is found only in the femur? Which of the following thing is found? See, the humerus has the lesser tubercle facing forward, but in the lower limb, it is facing backward. Remember, what is that structure that is there in the femur that is facing backwards? And there is another one, there is a greater one and a lesser one. So they are called the trochanters. So there is B answer. For you, 80th one is B. Okay. 80th one is B. So we always keep our morning, this is like morning first cup of coffee. So we are going to keep it very light and not very intimidating and not very, gushing through your head. It is very light. Osteology always is very light. Okay. So we cannot make ourselves feel bad when we don't get the answers right. So we'll keep it very light. All our mornings are going to be osteology based questions so that you can keep your mornings really going smooth. And then you can get into your tougher MCQs throughout the day. Okay, then we have 81st one. 81st one here we have, which of the following associations are not correct? Which of the following associations is not correct? You tell me now, which two do not go well? Medullary cavity, endosteum, medullary cavity and periosteum, no. First, no. Endosteum and yellow bone marrow. Medullary cavity and endosteum. You tell me 81C. It's not correct. You have to pick the one which is not correct. So the answer is C. I have already picked medullary cavity and periosteum. Periosteum is outside and medullary cavity is very much inside. So it is C. Rest of the things are correct. The perfect one is red bone marrow and spongy bone. Correct? That is the perfect one actually. Question number 82. Which of the following secures the periosteum to the bone. So you must have seen outer periosteum is actually perichondrium. Okay, perichondrium turns into periosteum. That is attached to the compact bone. Compact bone. How it is attached? Through small spikes or spokes-like structures. What are they called? They're called fibers. What are the names of these fibers? They're called Sharpie's fibers. Sharpie's fibers are very rich in collagen. They're collagen spikes. Okay. These are the ones which connect the periosteum to the underlying bone. So it is A. 82 is A. Next, coming to the 83rd one. Okay, the question itself is only one line or one word. So I was like, where is the question? Okay, the trabeculae is the question. I was really wondering where the question is. Trabeculae. Trabeculae are found in spongy bone. It gives spongy bone a lattice work. Are found in the compact bone, a big no first. It is a big no. So the answer here is, why would you say D? Why would you say D? A and B. Okay, fine. Are found in the spongy bone and it also has a framework, right? So it has a good framework. So it is A and B both. So the answer is D. All right. So that is 83rd one. Answer is D. Next, let's go to the question number 84. Which of the following is a primary curve of the vertebral column? Primary curve of the vertebral column. So there is secondary curvatures and primary. Primary is something that you are born with. What you are born with? You are born with the sacral curvature and you are born with the thoracic curvature. These two are primary. Okay, so now here we have to just mark the sacral and thoracic as the primary of the thing. So is it sacral is also called the pelvic and thoracic. So it is C and D. The answer is 1, 2, 3, 4, 5. E. The answer is E. 84. We have E. Okay. Next, 85. Which is not a characteristic of lumbar vertebrae. In lumbar vertebrae, what is that is not present? In lumbar vertebrae, everything is shorter. It is short and stout, lumbar vertebrae. The transverse process is short and stout. Spine is short and stout. It has got a large body. So thick spinous process is there. But we have to find the one which is not a characteristic. So let's not touch this way. Let's mark this off. Okay, thin, long spinous, oh, big no. That is a big no, right? It is not characteristic. First, I got the answer right. 85. What did you all get? 85th one. Transverse foramina is also not there. Correct. And this is there. This is there. So the answer is 1, 2, 3, 4, 5. The E. 85th one. Answer is E. Correct. 86th one. Let's go to the 86th one. What is your answer? Which is not part of the appendicular skeleton? We have axial skeleton and appendicular skeleton. You tell me which is not part of the appendicular skeleton. Is it vertebral column, patella, clavicle, os coccyx, skull? Appendicular skeleton which move the appendages and it is not in the center, which is not part of the appendicular skeleton. Vertebral column is in the center. Patella is in the center. Answer is A. Yes, it is A. 86. A. All right. Next one. 87. All of the following are functions of the skeletal system. Support blood cell of not this, calcium, excretion, respiration. Patella is also appendicular. D, the answer is D. You think 87th one? What is the answer? Which are all of the following are functions of the skeletal system? Are we supposed to tell which one doesn't belong except something should be there? Okay, calcium storage and support. These two are actually, this is also part of the, function of skeletal system, support and also storage of calcium. So it is A and C. I don't know why the question is like this. Next one, 88. Okay, we'll go to the 88th question. Osteoclast, about osteoclast, what do they do? What do they do, osteoclast? They deposit calcium into the bone. They destroy bone matrix, are a type of white blood cells. What are they? It could be except only, right? Yeah, that word is not there. So 88th one, let's move to the next one. 88th one, you tell me this. Osteoclast, see, remember, what do they do? They're bone chewing, right? Bone chewing. So you have to remember which is the answer now. Destroy bone matrix. Okay, so the answer is B. Eighth one is B. Next one, 89. All of the following are bones of the thorax. I think it is except which one? You have to add that word. So clavicle, sternum, throat, false ribs, all these are the bones of the thorax except the clavicle, which is not a bone of the thoracic region. So 89A. Correct? I hope you are with me because suddenly you've become very slow, drained out of energy or what? Yes, 87th also except. Everything is except. Wherever it is not given, we have to take it as except this one. Okay, when the question is like that, like a statement, then we have to take it as except. Okay, now you tell me 89th one. I'm in 89th one. It is? Okay, you told me 89th one is A or E. What is your answer? Except clavicle. Clavicle is appendicular skeleton, where it will become in the thorax. Oops. Give me a second. It has to be the sacrum. Yes, it is E. Yes, it is E. Sacrum. All right, sacrum, because I was only thinking about appendicular and axial skeleton. No. I told you all these questions. I'm also bumping into the questions for the first time. So I'm also solving the questions with you. So there is nothing like we go read and come. We also solve the questions with you. So we have to read the questions carefully. The bone of the upper limb is, the bone of the upper limb is, which are the bones of the upper limb? We have radius, ulna, humerus, or the say again, I think we have to go with the except, right? So it is ABC, bones of the upper limb is. Or should we remove this except? We'll go with radius, ulna, humerus. So it is A, B, and C. Yeah, that's better. When the question is not framed very well, we have to do it this. The bone of the upper limb is radius ulna humerus. Why? Femur lunate. Okay. This, this, and yeah, it is not given except. So this is lower limb bone. This is also upper limb bone. All right. So all this A, B, C, and E, the upper limb bone. So if you use except, then it will become femur as except one. So yeah, when questions are not in our favor, what can you do? Question number 92, the ribs. See, here also question is like a word. Ribs are the bones forming lateral thoracic wall. It's correct. How many pairs? Are several types described as typical, true, false, all this. This is correct. Have many features in common, head, neck, tubercle, angle, body, costal groove, correct. Known as floating ribs are attached to the sternum. Their floating ribs are attached to the sternum? No. So, are the floating ribs attached to the sternum? 11th and 12th are not attached to the sternum. So here the question itself is little tricky. So B and E is the actually wrong statement, right? So we can put it as A, C, D is right statement. Yes, that's what we'll do. Next one, 93 question. Ilium. So here also one word question. Ilium is a fan shaped. Ilium ischium pubis. What is the attachment on the ilium? Tell me. Ilium, what is attached on the inside? What is on the outside? On the inside, you have iliacus. And on the outside, what do you have? Gluteal lines, which give attachment to gluteus, medius, and minimus. Okay. Iliacus, gluteus medius, and minimus. Okay, that is ilium. It is fan-shaped bone that forms the lateral prominence of the pelvis. Yeah, iliacus has got this fan-shaped structure, and you also have that, you know, this one is the crest. Crest gives attachment to, here it is rectus femoris. Okay, anterior superior iliac spine, here it is sartorius and spinal ligament. And here rectus femoris. This is the notch, greater and the lesser sciatic notch. And the crest gives attachment to external oblique and TFL, tensor facial lata muscle. Okay, that is the attachment on the ilium. And on the outside, you have gluteus, and inside you have iliacus. Yes. Sacral tuberosity articulates with the sacrum. So ilium, it is a fan-shaped bone that forms lateral prominence of the pelvis. Correct. It's one of the three bones that forms the, yes. It has a body that participates in the formation of glenoid cavity. Yes. Has an anterior superior iliac spine at the anterior end of the iliac crest. Right. Has arcuate line, which is inferior boundary of the arcuate line is no. Okay, I was just thinking where is the wrong answer. So this is the wrong answer. Okay, where is arcuate line? Arcuate line is a line that is present between, I'm just going to draw this umbilicus. This is the tubercle. So this is the line, arcuate line. That is the distance between the umbilicus and pubic tubercle. The midpoint is, if you draw a line, that is arcuate line. That is regarding rectus sheath we talk about. Rectus sheath, when we talk about the arrangement of the rectus sheath. Okay, that comes into picture. So arcuate line doesn't come here. So the answer is what? Answer is that doesn't belong is E. I think that is E, right? 1, 2, 3, 4, 5. Yeah, E. So here it is 93E. Okay, next one. 94. What do you think is the answer? 94th one. 94th one. The phalanges are. Tell me the phalanges now. Phalanges are. Long bones, short bones, 13, 14, 15. B, they're all short bones. Yes, that is the 94. Next, 95. The hip bone it consists of ilium, ischium, and pubis. There is ilium, ischium, pubis. Okay. So it is B, it is C, and E. C, E. Okay, yes. That was the last question we are going to look at. 96. The elements in proximal end of the radius. The elements in the proximal end of the radius. You tell me proximal end of the radius, distal end and proximal end. So here we have styloid process, fovea articularis. Fovea articularis, proximal end we have. So that is the answer. And you also have tuberosity. In the adult vertebral column, if you look at primary curves are in the thoracic and sacral region. Yes, that is correct. There are more flexion and extension in the lumbar region than in the thoracic region. That's also correct. There is more rotation about longitudinal axis in the thoracic region than in the lumbar region. That's not correct. The transverse process are posterior to the articular process in all the vertebrae. Yes. The shape of the intervertebral disc contributes to the secondary curvatures. Yes. So this is the answer that does not belong. That is C. 98th one. So we have almost end of the session. Lumbar vertebrae show the following features. They have flat articular process. They have flat articular process, and the transverse process become progressively longer from above downwards. That's also correct. The plane of joints between the articular process is sagittal. It is not sagittal. So the answer is C. 99th one. In thoracic vertebrae, this is the last one. I don't know why they would end at 99. Why not 100? In thoracic vertebrae, all the spinous processes are long and pointed downwards. Correct. All the transverse processes have articular facets for the ribs. Not. Yes. All the bodies have two articular facets on each side. Transverse process increase in length from above downwards. All the superior articular processes are more or less in coronal plane. The answer for this one, what would be not right, is the bodies have two articular facets, not all of them. So it is C. Okay, 99th one is C. All right, so with this, I would like to end me, Dr. Rohini, signing off. Thanks for joining. You have a good day.